Dr. Simon, why is it so important that people wear masks if they're going into a crowded space, if they can't socially distance?
It's important because it prevents the spread of not just COVID, for any particular virus. Um, and that's been well shown, numerous studies, that when you get in enclosed spaces or open spaces where you're really crowded, like stadiums, keeping masks on can decrease the risk of spread of basically any virus, but certainly COVID, by up to 70%. It's not perfect for sure, but it offers a degree of protection. And so I always carry my mask with me, and when we get into public, it always goes on. When I even go into a grocery store with only 4 or 5 people, I wear it. But if I were to go to the fair, there's no question I would have that mask on the whole time, whether I'm indoors or outdoors, unless I'm eating a hot dog or something like that, which I really like, I would take it off. But right now, I'm not so sure I'd want to go into a place like the fair or a stadium without a mask on, with COVID as rampant as it is at the moment. And
Hmm.
having said that, I've been vaccinated, and I've actually had the booster vaccine. So I've actually had three shots, and I still would wear a mask everywhere in public I go. I would try to stay away from people I don't know that aren't vaccinated. I would try to, if you do go to the fair, keep your distance from other people as much as you possibly can and keep the masks on. And I would not confront, but I would avoid anybody who does not have a mask on.
We've all heard of people who got vaccinated and still got COVID. And some people feel like, well, why should I get vaccinated if I'm just going to get COVID anyhow? So what would you say to that person?
Well, I'd say in a lot of senses, that depends on who that person is. So if you're vaccinated, you're 5 times less likely to get COVID, but vaccines don't prevent spread of infection. You can still get COVID with the vaccine, but you're 5 times more likely to get COVID if you're not vaccinated. So it does offer a huge protection. This is just recent data that's come out in the last week or so. But you're 29 times more likely to be hospitalized with serious illness if you've not been vaccinated. And if you look at your risk of dying, it's negligible. It's less than 0.5% if you're hospitalized. So the risk of really getting seriously ill and dying is dramatically decreased if you have been vaccinated. The other studies have shown that although you can still spread COVID if you've been vaccinated, you're not going to spread it for as many days as if you're unvaccinated. So vaccines aren't perfect, but they sure are helpful, and dramatically so. 90 to 95% plus patients in the hospital right now with COVID are unvaccinated. And it's well over 99% of 98 to 99% of patients who have died of COVID in the hospital are unvaccinated. So when you just look at those numbers, you're going, of course, I want to get vaccinated. It not only protects me, but vaccinated people are going to protect others. It's one of the only ways you can ever get to what's called herd immunity, which really requires 90 to 95% of people be immune to an illness or even higher. And with this new Delta variant that's very infectious, the only way we're ever going to get to anything resembling herd immunity is by mass vaccinations. I mean, we did this years ago with polio. I remember being a little kid when we first moved to Walla Walla from Ohio back in 1961. Everybody stood out in the sidewalk around Pioneer Junior High School to get their polio vaccines. It was a community effort. That same thing can happen if we were to all get vaccinated. We will decrease the risk of infection, of hospitalizations. You'll be protecting yourself, but most importantly, you'll be protecting your other family members, your friends, and you'll be protecting, in a sense, the healthcare system, which is right now overburdened. Our hospitals throughout southeastern Washington, northwestern Washington are full. It's not only of COVID patients. COVID patients make up about 30, maybe 40% of hospitalizations. But when there's that many that are in there with one illness, that means other people, car accidents, brain trauma, neck fractures, heart attacks. There is limited access to those people, such that a couple of weeks ago, if you had a patient you needed to transfer, you couldn't find a hospital to transfer them to. So the power of vaccines is it also protects all of us in society. Um, the data is really clear that the side effects of the vaccine are minuscule, especially when you compare them with the side effects of getting COVID. And it's about 7% of the state of Washington has experienced COVID already. It's not a fun disease. This is not a joke. This is very, very serious.
I think, looking at the demographics of people who are getting vaccinated, as people get younger and younger, they're less likely to get vaccinated. And a lot of the younger people maybe had friends that got COVID and didn't really get sick. We've been talking about the reproductive number of the new Delta variant, where the original strain, if you got COVID, you would maybe infect 1 or 2 people. The Alpha strain, if you got that strain, maybe you infected 2 to 4 people. And now the Delta variant, you're infecting about 8 people.
Mm-hmm.
They say it's just as infective as chickenpox. And that, I guess that's one good reason why young people should get vaccinated, to protect that spread.
Absolutely. That it may be slightly less than chickenpox, but it's in the 6 to 8 other people range for sure.
Mm-hmm.
But for everybody who tells me I'm not going to get a vaccine, I don't believe in vaccines, what I always say is, well, the last time you had a farming accident, you cut yourself, got dirt in your wound, did you take a tetanus shot? The answer, of course I did. A tetanus shot is a vaccine. I mean, vaccines are what protect us. And people who say, well, I was in the military, I have choice. And I say, well, the first day in boot camp, you got like 14 immunizations.
Mm-hmm.
There's a reason for this. They work and they are safe. But right now with COVID, especially spreading and spreading among young people, is as you get sick, then society has to sort of shut down a little bit. And although most of the time COVID is just a really bad cold, there's no question about that for young people, but it's not always that way. And if it's your child or your spouse that gets really sick from COVID, all of a sudden it takes a whole different meaning than if it's somebody else's. And the thing that's so frustrating about this is these vaccines really do work. Yes, you might need to get booster shots every now and again. Well, that's true in everything that we vaccinate against. The immunity against these various viruses is probably not lifelong. But it's just a fact of life that makes things just a lot nicer for all of us. You don't want to go through the pain of either getting COVID yourself or having a loved one get it and die. It's not fun.
Today at the Board of Health call, I reported some CDC information that said that the hospitalization rate among those 50 and under is the highest that it's been throughout the whole pandemic. So this is really hitting people under the age of 50.
Yes, it is. And so what you're saying is, well, most people under 50 don't get sick. Why all the hospitalizations? And the reason is just what you said, Jake, is that this is a much more infectious variant. Is we're seeing a lot more infections. So as you see a lot more infections, you're going to see a lot more people in the hospital, and our health system just cannot not handle on a regular basis 30% of hospitalized patients, or 40% even, with just one type of illness. I mean, there are other people we have to take care of too. And this is also burning out our staff. It's hard to staff the beds the way we want to. This is a very serious pandemic, and for those of us who have kept up on it and stuff, and say there is a vaccine which actually could help dramatically. It's not going to eliminate it, but it's going to help dramatically. Now, if we could get vaccines up to 95 to 99%, probably this is going to pretty much go away. The other reason you want to get vaccinated to limit spread is the more this virus is out there, viruses are like all living things, they mutate. This is not going to be the last mutation we see. What if we get a mutation that's infectious, but also much deadlier? Well, the more virus there is out there, the more likely that is to occur. So that would be another reason. And the vaccine, it hurts for a day or two, and that's about it. It's nothing.
I know there's a lot of concerns about the safety of the vaccine, and Dr. Yao-Hianen had a nice article in the Union Bulletin that outlined the development, outlining the fact that this is not a this is not new technology. It's actually relatively old technology. But some people get a sense that it may be quote unquote experimental. Of course, Pfizer is now has full authorization. Can you just make a few comments about the safety of vaccines,
Right.
of the COVID vaccines?
So when you look at the various vaccines, there's multiple ways to make a vaccine. So what's being done with a lot of with the Moderna vaccine and the Pfizer right now in particular is their messenger RNA vaccines. This is really a cool concept. So what they do is they take a messenger RNA, a chemical that's part of the virus, that when it gets into a human cell, like a muscle cell, enzymes get activated so that viral messenger RNA that's been specifically picked out. It's not the RNA for the whole virus. It's just for a couple of little spike proteins, which are little proteins that are in the virus outside of it, which is what attaches to the lungs and the throat and gets you sick. And if you get antibodies to those particular chemicals, that minimizes the risk of illness. So what happens is, by these messenger RNA vaccines get into your muscle cells, your muscles make the proteins, and then they kill that messenger RNA. It never gets incorporated into your DNA. You never get exposed to a whole viral particle. This cannot cause COVID, but it produces these little proteins, and the body can recognize them and develop antibodies as well as a degree of cell-mediated immunity. So this is actually theoretically one of the safest vaccines we've ever had, as opposed to some older vaccines, not COVID, that are actually take the live virus and you try to kill it completely. That was one of the first polio vaccines, but unfortunately not all of the virus did get killed. And so every now and again you would see with polio from the vaccine itself. That doesn't happen. That cannot happen with the vaccines we're using right now for COVID. You can also take a viral particle and you grow the virus repeatedly in culture dishes until it gets to the level that it's the original virus, sort of, but it's got some chemical changes such that it's not as infective nor as dangerous. This is how the smallpox vaccine started and cowpox back years ago. In fact, the farming community and the ranching community has been using the vaccine technology for 100 years. That's how you keep animals healthy and keep them alive. The Johnson & Johnson vaccine acts a little differently, but it's also a unique pathway. So the Johnson & Johnson vaccine is actually an adenovirus, a fairly benign virus that gets into the body, and it's got stuff inside of it, genetic stuff inside of it that the body uses to make, again, these various spike proteins, and then the body actually kills that adenovirus. So you can't get COVID from that either. So the technology we have right now has been around for a while. At least a decade to 15 years, this messenger RNA and the adenovirus. I can't remember what they call those kind of the vector viruses vaccines. They've been around for years. They're very, very, very safe, and they're very, very effective. So this technology is just phenomenal. Mm-hmm. And because science has advanced so much, and a lot of this RNA chemistry has been it's such that you can identify the various proteins, manufacture the RNA very easily with automation. So not everything needs to be grown like in the old days where you had to raise the antibodies in horses and all that kind of stuff. It's exploded, the technology. Mm-hmm. These vaccines are very, very safe. The testing process, they did not skip steps, but they did merge steps so that we could respond quickly to this. Now, I can't imagine what our caseload rate would be right now if we didn't have the vaccines. So no, they're very safe.
Well, thank you so much, Dr. Simon.